Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. In infants and children, most cardiac arrests result from A. Ventricular fibrillation, B. Ventricular tachycardia, C. Respiratory failure or shock, D. None of the above. Correct answer, C. Respiratory failure or shock. Although the ventricular arrhythmias may precipitate cardiac arrest, the most common cause of cardiac arrest in children is respiratory failure or shock. 2. When considering the structural organization of the human body, which of the following is the basic unit of life? A. Chemicals, B. Atoms, C. Molecules, D. Cells. Correct answer, D. Cells. The basic unit of life is the cell. Cells are made up of atoms, molecules, and chemical structures. However, these items are not considered life forms. 3. When a patient is standing in anatomical position, where are his feet? A. Facing forward with the toes spread open, B. Facing out to the sides to open the hips, C. Side by side and facing forward, toes resting comfortably, D. The feet are pointed inward. Correct answer, C. Side by side and facing forward, toes resting comfortably. A person standing in an anatomical position is standing with his feet side by side, palms of the hands facing forward from arms that are straight and slightly away from the sides. 4. Which of the following would alert the nurse to respiratory distress in the newborn? A. Respiratory rate of 50 breaths per minute, B. Acrocyanosis, C. Circumoral cyanosis, D. Nasal flaring and retractions. Correct answer, D. Nasal flaring and retractions. Nasal flaring and retractions indicate that the newborn is working hard to breathe. The other choices are normal findings in the newborn. Acrocyanosis and circumoral cyanosis are common in the first day of life, and normal respiratory rate in a newborn is 30 to 60 breaths per minute. 5. Which of the following is an example of a positive effect of exercise on a client? A. Decreased basal metabolic rate, B. Decreased venous return, C. Decreased work of breathing, D. Decreased gastric motility. Correct answer, C. Decreased work of breathing. There are many positive benefits that clients can derive from exercise, including increased metabolic rate, increased gastric motility, and increased venous return. Exercise decreases a client's work of breathing, such that regular activities require less effort. 6. You have been assigned to take an apical pulse for one of the patients on the nursing unit. How will you do this? A. You will place the stethoscope over the heart and listen for any irregular beats. B. You will place the stethoscope over the heart and count the beats per minute. C. You will place your fingertip over the patient's wrist and feel for any irregular beats. D. You will place your fingertip over the patient's wrist and count the beats per minute. Correct answer, B. You will place the stethoscope over the heart and count the beats per minute. An apical pulse is taken by placing a stethoscope over the heart and counting the number of beats per minute. Although you will also listen for an irregular pulse, an apical pulse is the number of beats per minute. 7. When a nurse does a pulse, he should note which of the following? A. Rate, B. Rate and quality, C. Rate, quality and fullness, D. Rate, quality, fullness and regularity. Correct answer, C. Rate, quality and fullness. When you do pulses, you should note all the characteristics of the pulse. These characteristics are rate, number of beats per minute, quality, is it regular or irregular, and fullness, is it thread and weak or is it full and bounding? 8. What term is used to describe the sexual response changes among middle-aged men? A. Menopause, B. Climacteric, C. Generativity, D. Maturity. Correct answer, B. Climacteric. Sexual arousal among both men and women takes longer in midlife than it did in younger years. For men, this period of time is called the climacteric, and for women, it is called menopause. 9. Mr. Roberts, a 68-year-old man, notices a gradual loss of hearing. This sensory change is called _. If. Presbycusis. B. Xerostomia. C. Myopia. D. Presbyopia. Correct answer, presbycusis. Presbycusis is the loss of hearing ability related to the aging process. It is considered a normal physical change in the elderly age group. 10. Changes, such as retirement, grandparenting, and increased dependence on others, are examples of what kind of changes? A. Moral. B. Psychosocial. C. Self-esteem. D. Psychomotor. Correct answer, B. Psychosocial. Retirement, grandparenting, and increased dependence on others are examples of psychosocial changes. 11. The community health nurse is educating a group of middle-aged women about recommended health screenings. Which of the following statements indicates that the client has understood the recommended health screenings for a 50-year-old female? A. I should get a pap smear every year. B. I should get a mammogram every 3 years. C. I should get a colonoscopy every 10 years. D. I should get my blood glucose checked every 5 years. Correct answer, C. I should get a colonoscopy every 10 years. The recommendation suggests that a 50-year-old female should complete a fecal occult blood test every year, or flexible sigmoidoscopy every 5 years, or colonoscopy every 10 years. Also included in the recommendations is that a 50-year-old female should get a mammogram every 2 years and a pap smear every 5 years. Blood glucose should be checked at least every 3 years starting at age 45 if no other risk factors are present. 12. Nursing care plans are _ A. Written by CNAs before they provide care. B. Guidelines of care that all nursing team members use. C. Used by nurses but not by nursing assistants. D. Used by nursing assistants but not by nurses. Correct answer, B. Guidelines of care that all nursing team members use. Nursing care plans are documents that are developed by RNs but shared with all members of the nursing care team. The purpose of these nursing care plans is to ensure that all patients have quality care in a consistent manner. 13. Nursing care plans contain which of the following? A. Nursing diagnoses. B. Medical diagnoses. C. MD orders. D. Intake and output forms. Correct answer, A. Nursing diagnoses. Nursing care plans are legal documents that contain nursing diagnoses, such as an alteration of respiratory function. They also contain patient goals and nursing interventions. 14. One major difference between long-term care and respite centers is the fact that long-term care facilities provide only physical care and respite centers give both physical and emotional care. B. Provide care for residents on a long-term basis and respite centers offer only outpatient services. C. Provide care for residents on a long-term basis and respite centers offer only temporary services. D. There is no difference. Long-term care and respite care are the same. Correct answer, C. Provide care for residents on a long-term basis and respite centers offer only temporary services. The major difference between long-term care and respite centers is the fact that long-term care facilities provide both physical and emotional care on an ongoing, long-term basis. On the other hand, respite care centers provide these same services but on a short-term, or temporary, basis so family members can have time off from their daily caregiver role. 15. Penny Thornton has had a stroke, or CVA. She is having difficulty eating on her own. Soon, she will be getting some assistive devices for eating meals. Which healthcare worker will be getting penny these assistive devices? A physical therapist. B. A speech therapist. C. A social worker. D. An occupational therapist. Correct answer, D. An occupational therapist. Occupational therapists assess the needs of residents and patients in terms of their need for assistive devices that can help them with the activities of daily living. Some of these assistive devices include weighted plates and special forks or spoons to assist the person to eat on their own. These devices enable the person to be as independent as possible. 16. A patient will be discharged from the hospital today. Which person will most likely arrange the discharge of this patient to his or her own home, to a nursing home, or assisted living facility? A physical therapist. B. A speech therapist. C. A social worker. D. An occupational therapist. Correct answer, C. A social worker. Social workers collaboratively work with other healthcare professionals, such as nurses and doctors, to discharge patients from the hospital to the best type of facility that meets their needs. They help the team to ensure the continuum of care after discharge. 17. Who is the center of care? A. The nurse. B. The doctor. C. The administrator. D. The patient. Correct answer, D. The patient. The patient is the center of care and the center of the team. The patient is the most important member of the team. Healthcare workers must all work together, as a team, to best meet the needs of the patient. The healthcare team works every day and every minute towards the goal of good healthcare. The patient is the main decision maker, the patient is the main focus of the team. They have a right to good care by all of the members of the healthcare team. 18. A staff nurse working on a medical surgical unit witnesses another nurse reviewing a patient's EMR that she is not assigned. What should the staff nurse do next? A. Question the nurse why she is reviewing that patient's chart. B. Notify the charge nurse. C. Notify the unit director. D. Call the Human Resource Anonymous hotline. Correct answer, question the nurse why she is reviewing that patient's chart. The nurse who witnessed the potential violation of EMR should first question the nurse, as this is the appropriate step according to the chain of command. The charge nurse and/or unit director would be notified if EMR misuse was validated. 19. You are working as a valued member of the team on your nursing care unit. You are trying to figure out whether or not the team is doing well. Which of the following is a sign that your team is doing well? A. Conflict occurs, but this is seen as an opportunity for team growth and development. B. No negative feelings are ever expressed, so everyone is happy and satisfied. C. Mistakes are not tolerated. Mistakes result in disciplinary action. D. People are not taking risks and they are sticking to the status quo. Correct answer, conflict occurs, but this is seen as an opportunity for team growth and development. Some of the signs that a team is successful include the existence of conflict and the belief that this conflict can be resolved, and it can also lead to team growth and development. Other signs of a successful team include accepting mistakes as learning opportunities and the ability to express negative feelings when these feelings arise. 20. The primary purpose of a patient care meeting or conference is to determine which of the following. A. The patient's ability to pay for the costs of their care. B. How the healthcare team can best meet the patient's needs. C. The patient's physical status and condition. D. The patient's psychosocial status and condition. Correct answer, B. How the healthcare team can best meet the patient's needs. The primary purpose of a patient care meeting or conference is to determine how the members of the entire healthcare team can best meet the unique, individual needs of the patient. The patient and family members should be included at this conference or meeting. The patient is the center of care. 21. Who should be members of a patient care conference? A. Doctors, nurses and nursing assistants since they are healthcare providers. B. Doctors, nurses and the patient and/or the family members. C. All members of the healthcare team. D. All members of the healthcare team and the patient/resident. Correct answer, D. All members of the healthcare team and the patient/resident. The patient or resident is the center of care. The patient or resident and/or their family members along with all other members of the healthcare team should be included in a patient care conference. Family members may, or may not, be included in accordance with the patient's or resident's wishes. 22. An 18-year-old female is admitted to the emergency room complaining of abdominal pain, nausea, and vomiting. Lab results indicated an elevation in alkaline phosphatase, bilirubin, and a positive HCG. The patient's parents are at the bedside. Which of the following actions, if taken by a nurse, would signify that the nurse is acting as a patient advocate? A. Directly discussing the results with the patient and family. B. Asking the family to leave the room so the nurse may speak to the patient alone. C. Assuming the patient knows she is pregnant and begin discussing treatment options. D. Administer morphine 2 mg for push stat for patient's 10/10 pain. Correct answer, B. Asking the family to leave the room so the nurse may speak to the patient alone. The nurse has the responsibility to support and uphold the patient's health, wellness, safety, and rights. The patient must protect the patient's privacy, assuming the patient is unaware that she is pregnant. The patient has the right to the opportunity to receive results in private. 23. A nurse is preparing to administer an enema to a 64-year-old client. Which of the following actions of the nurse is most appropriate? A. Assist the client to lie in the semi-Fowler position. B. Apply lubricating jelly to the tip of the catheter before insertion. C. Instill a total of 30 cubic centimeters of fluid into the client's rectum. D. Ask the client to hold the solution in for 30 seconds. Correct answer, B. Apply lubricating jelly to the tip of the catheter before insertion. When administering an enema to a client, the nurse should place the client in the Sims position for easy access. Lubricating the tip of the catheter, the nurse should instill a maximum of 750 to 1,000 cubic centimeters of fluid for an adult client. Following administration, the nurse should ask the client to hold the solution for at least 5 minutes. 24. Which of the following is a fat-soluble vitamin? A. Vitamin C. B. Vitamin D. C. Vitamin B6. D. Riboflavin. Correct answer, B. Vitamin D. Fat-soluble vitamins are those that can be stored within the body. If a person takes in more than necessary, excess amounts can be stored to be used for later. Although this may be beneficial to avoid vitamin deficiencies, fat-soluble vitamin toxicities may also occur. Fat-soluble vitamins are vitamins A, E, D, and K. 25. A nurse is preparing to administer an enteral feeding through a gastrostomy tube. Before administering the feeding, the nurse aspirates some stomach contents and checks the pH. The result is 3.9. What is the next action of the nurse? A. Administer the feeding as ordered. B. Pull the feeding tube out approximately 3 centimeters. C. Flush the feeding tube with 60 cubic centimeters of water. D. Contact the physician. Correct answer, A. Administer the feeding as ordered. Checking the pH before administering an enteral feeding verifies placement that the gastrostomy tube is in the correct position. A pH of 4 or less indicates that the tube is in the stomach and the nurse may continue with the enteral feeding. 26. How many CCS are there in 25 ounces? A. 250. B. 500. C. 750. D. 1000. Correct answer, C. 750. There are 30 cubic centimeters per ounce. There are 750 cubic centimeters in 25 ounces. 27. your patient has finished a 12-ounce can of iced tea and 8 ounces of fresh orange juice. What will you record on the intake and output form for this patient's intake? A. 20 cubic centimeters, B. 20 centimeters, C. 600 cubic centimeters, D. 600 centimeters. Correct answer, C. 600 cubic centimeters. You will record 600 cubic centimeters of fluid intake. There are 600 cubic centimeters in 20 ounces, 8 plus 12 is equal to 20, of fluid intake. 28. Your patient ate an 8-ounce cup of Italian ice. How much will you record on the patient's intake and output form in terms of this patient's fluid intake? A. 240 cubic centimeters, B. 120 cubic centimeters, C. 8 cubic centimeters, D. 0 cubic centimeters because Italian ice is not a fluid. Correct answer, 240 cubic centimeters. You will record 240 cubic centimeters of fluid intake. Italian ice is considered a fluid. 29. Which of the following bony landmarks is described by large, blunt, irregularly shaped process, such as that found on the lateral aspect of the proximal femur? A. Tubercle. B. Tuberosity. C. Condyle. D. Trochanter. Correct answer, D. Trochanter. The greater trochanter is found on the lateral aspect of the proximal femur and is a bony process that is large. This process forms the attachment site for many muscle of the legs. 30. A patient who is blood type AB, A, can receive plasma from a type B donor. B, can receive whole blood from a type A donor. C, can receive packed RBCs from a type O donor. D, all of the above. Correct answer, C, can receive packed RBCs from a type O donor. A patient who has blood type AB has AB antigens on his red blood cells. A donor that has antibodies to AB antigens cannot donate plasma to an AB patient. Of the above listed answers, only an O-type donor can donate to this patient as O donors have no antibody-stimulating antigens and no donated antibodies since the donation was packed red blood cells. 31. To properly read a meniscus, A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. B. Hold the measuring device at eye level and read the top of the curve of the liquid level where the liquid holds to the walls of the container. C. Hold the measuring device at table level and looking down into the measuring device, read the bottom of the curve of the liquid level. D. Hold the measuring device at table level and looking down into the measuring device, read the top of the curve of the liquid level. Correct answer, A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. To accurately measure liquids that are in containers, hold the container at eye level and read the volume at the bottom of the meniscus. 32. A physician has written an order for 2.0 mg MSQ 2 to 4 hour PRN pain. What is the nurse's response to this order? A. Give 2 mg of morphine sulfate to the client. B. Give 20 mg of morphine sulfate to the client. C. Contact the pharmacy to clarify the order. D. Contact the physician to rewrite the order. Correct answer, D. Contact the physician to rewrite the order. This order has errors that could potentially result in harm to the client if not followed correctly. The use of 2.0 involves a trailing decimal point, which can cause confusion as to the dose of the drug. The abbreviation MS is one of the Joint Commission's do not use abbreviations, as this could mean morphine sulfate or magnesium sulfate. Although the order states the drug should be used for pain, the nurse should clarify with the physician as to the exact dose and drug to be used. 33. A nurse is providing care for a 49-year-old male patient who has been diagnosed with Hodgkin's lymphoma. He is admitted to the unit after undergoing a bone marrow transplant and for continued monitoring for complications. His lab results reveal hemoglobin 7.2, HCT 25%, platelets 50,000, WBCs 5,000. Based on these lab results, the nurse must remove all live plants and flowers from patient's room. B. Ensure all visitors wear masks. C. Monitor for occult bleeding. D. All of the above. Correct answer, D. All of the above. After interpretation of the lab results, the nurse should understand that the patient is experiencing pancytopenia. Therefore, the patient is at high risk of bleeding and infection. The nurse must remove all live plants/flowers, ensure visitors wear masks and monitor for all signs and symptoms of bleeding. 34. A nurse is providing care for a 74-year-old female patient who has been admitted following a CVA. The patient has had an NG tube placed for nutrition and is NPO. She is alert, oriented to self only, lung sounds are diminished in the bases, and has left-sided paralysis secondary to her CVA. Her vital signs are as follows: T 102.3, P 98, ARC 20, BP 135/65, SP 02-90% on room air. What should be the initial action performed by the nurse? A. Stop the feeding. B. Administer oxygen at 2 liters nasal cannula. C. Suction the airway. D. All of the above. Correct answer: stop the feeding. The nurse should initially stop the feeding to the patient with the understanding that aspiration pneumonia is a likely cause of the elevated temperature and diminished breath sounds. After the feeding is stopped, the physician should be notified because a chest X-ray may be needed. All other information provided is normal relative to the patient's scenario. 35. Which of the following is classified as a prerenal condition that affects urinary elimination? A. Nephrotoxic medications. B. Pericardial tamponade. C. Neurogenic bladder. D. Polycystic kidney disease. Correct answer, B. Pericardial tamponade. A prerenal condition is that which causes reduced urinary elimination due to a diminished blood flow to the kidneys. A condition such as cardiac tamponade affects the heart's ability to pump adequate amounts of blood, thereby reducing blood flow to vital organs throughout the body, including the kidneys. 36. A client is having difficulties reading an educational pamphlet. He cannot find his glasses. In order to read the words, he must hold the pamphlet at arm's length, which allows him to read the information. Which vision deficit does this client most likely suffer from? A. Cataracts. B. Glaucoma. C. Astigmatism. D. Presbyopia. Correct answer, D. Presbyopia. Presbyopia is a condition that occurs when the lens of the eye loses accommodation and is unable to focus light on objects nearby. As a result, clients are unable to see or read items up close but may have success when holding the same item at arm's length. Many clients with presbyopia must wear bifocals, but long-distance vision remains unaffected. 37. A client with an enlarged prostate is having trouble starting his flow of urine when using the bathroom. Another name for this condition is A. Hesitancy. B. Oliguria. C. Retention. D. Urgency. Correct answer, A. Hesitancy. Urinary hesitancy occurs when a client has difficulty with starting a flow of urine while using the bathroom. Hesitancy may be due to physiological factors, such as obstruction from an enlarged prostate, or due to psychological factors, such as anxiety or embarrassment. 38. Which of the following statements best describes substance P? A. Substance P decreases a client's sensitivity to pain. B. Substance P levels are drawn before administration of narcotic analgesics. C. Substance P is found in the brain and is responsible for pain control and management of depression. D. Substance P is found in the dorsal horn of the spinal column. Correct answer, D. Substance P is found in the dorsal horn of the spinal column. Substance P is a type of neurotransmitter that is found in the brain and the dorsal horn of the spinal column. Substance P may cause inflammation and edema, as well as pain. It may be associated with specific syndromes that produce pain for the client, including fibromyalgia or arthritis. 39. Preload refers to A. The volume of blood entering the left side of the heart. B. The volume of blood entering the right side of the heart. C. The pressure in the venous system that the heart must overcome to pump the blood. D. The pressure in the arterial system that the heart must overcome to pump the blood. Correct answer, B. The volume of blood entering the right side of the heart. Preload is the volume of blood that enters the right side of the heart. This volume stretches the fibers in the heart prior to contraction. Preload is commonly measured as atrial pressure. 40. You have measured the urinary output of your resident at the end of your 8-hour shift. The output is 25 ounces. You should do what next? A. Convert the number of ounces into CCS. B. Convert the number of ounces into CMS. C. Immediately report this poor output to the nurse. D. Know that 25 ounces of urine is too much in 8 hours. Correct answer, convert the number of ounces into CCS. You have to mathematically convert the ounces into CCS because CCS is the unit of measurement that is used to record intake and output. This urinary output is within normal limits, so there is no reason to immediately report it to the nurse. You must report urinary outputs of less than 30 cubic centimeters per hour. 41. The term afferent nerve means carrying an impulse to the brain. B. Carrying an impulse away from the brain. C. Carrying impulses to the motor neurons of the appendicular muscles. D. None of the above. Correct answer, carrying an impulse to the brain. Afferent nerves carry sensory signals to the brain. Different nerves carry motor signals from the brain. 42. The medical term, basophilia, refers to A. An attachment of the epithelial cells of the skin to a basement membrane. B. An overabundance of a particular white blood cell in the peripheral blood. C. An underrepresentation of basophils on a blood smear. D. None of the above. Correct answer, B. An overabundance of a particular white blood cell in the peripheral blood. Basophilia is an increased number of basophils in the peripheral blood. Basophilia is found in certain blood disorders such as leukemia and also in some types of allergic reactions. 43. A nurse is performing discharge instructions to a patient who has undergone a left total hip replacement. The nurse is providing instructions on the correct use of a cane following their discharge to home. Which one of the following statements indicates the patient needs further instruction? A. I should always make sure the cane is on the left side of my body. B. I should always make sure I use both legs to support my body weight. C. I should move the cane about 10 inches in front of me when I use it to walk. D. I should move my left leg first, then my right. Correct answer, A. I should always make sure the cane is on the left side of my body. The question is asking which of the following statements is incorrect. A is the incorrect answer because the cane should always be on the strong side of the body, thus it must be determined which side of the body is strong and which side is weak. In this scenario, the right side of the body is the patient's strong side because the patient was operated on the left side. 44. A term used to refer to generalized wasting of body tissues and malnutrition is called A. Entropion. B. Confabulation. C. Induration. D. Cachexia. Correct answer, D. Cachexia. Cachexia is a term used to describe the generalized wasting of body tissues, ill health, and malnutrition that is associated with some chronic diseases. Cachexia involves a loss of fat tissue to protect the bones and joints. Clients with cachexia are at risk of pressure ulcers in addition to complications associated with malnutrition and poor health. 45. Which of the following clients is at a higher risk of developing oral health problems? A. A pregnant client. B. A client with diabetes. C. A client receiving chemotherapy. D. Both B and C. Correct answer, D. Both B and C. Some clients are at higher risk of developing oral health problems due to changes in the mouth associated with certain diseases, or an inability to provide proper self-care and oral hygiene. Diabetic clients may be more likely to develop periodontal disease, gingivitis, or mouth dryness. Clients receiving chemotherapy may have mouth ulcers or gingivitis, leading to further pain and infection. 46. A nurse is providing care for a patient who has undergone a left knee replacement. Upon assessment, she notices that the patient has redness, warmth, and swelling on the right calf. The patient also complains of increased pain in the right leg when ambulating. What would be the priority nursing action? A. Elevate the right leg. B. Perform Hohmann's sign. C. Administer anticoagulants. D. Notify the physician immediately. Correct answer, D. Notify the physician immediately. Redness, warmth, swelling and pain are all signs and symptoms indicative of a deep vein thrombosis. Thus, this is a situation where the physician needs to be notified immediately. The affected leg should be elevated after the physician is called. A Hohmann's sign should not be performed, as this is no longer recommended practice. 47. A client has developed a vitamin C deficiency. Which of the following symptoms might the nurse most likely see with this condition? A. Cracks at the corners of the mouth. B. Altered mental status. C. Bleeding gums and loose teeth. D. Anorexia and diarrhea. Correct answer, C. Bleeding gums and loose teeth. A client with a severe vitamin C deficiency has a condition called scurvy. Clients with scurvy are most likely to develop bleeding gums, loose teeth, poor wound healing, and easy bruising. 48. In which of the following ways can the nurse promote the sense of taste for an older adult? A. Mix foods together on the dinner tray. B. Avoid cologne, air fresheners, or room deodorizers. C. Encourage the client to chew food thoroughly. D. Discourage the use of salt or seasonings with prepared food. Correct answer, C. Encourage the client to chew food thoroughly. As clients age, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. 49. A nurse is caring for a client who died approximately 1 hour ago. The nurse notes that the client's temperature has decreased in the last hour since his death. Which of the following processes explains this phenomenon? A. Rigor mortis. B. Postmortem decomposition. C. Algor mortis. D. Livor mortis. Correct answer, C. Algor mortis. Algor mortis occurs after death when the body's circulation stops and the client's temperature begins to fall. The client's temperature will drop by approximately 1.8 degrees per hour until it reaches room temperature. The client's skin gradually loses its elasticity during this time. 50. A nurse is caring for Mrs. T, a client with expressive aphasia. During a bath, she begins to gesture wildly and point toward the bath water, yet is unable to say anything. Which response from the nurse is most appropriate? A. Is something wrong with the bath water? B. Just calm down, we'll finish your bath soon. C. Are you trying to tell me something? D. Shall I turn on the television? Correct answer, A. Is something wrong with the bath water? A client with expressive aphasia can understand when others speak to her, but may be unable to form the correct words or phrases to respond. In this situation, the client is obviously trying to tell the nurse something, but cannot get the words out. The nurse should try to pinpoint the subject the client is trying to bring up. 51. A patient with leukemia is being taken off life support and the patient's daughter says to the nurse, "This should be my mom dying, not my dad. She has drank all these years and is still living." Which stage of grief is the daughter in according to Kubler-Ross? A. Denial. B. Anger. C. Bargaining. D. Depression. Correct answer, B. Anger. The daughter is experiencing anger, the second stage of grief according to Kubler-Ross. During this stage, a client displaces anger at the situation onto other people or things. 52. Which of the following interventions is most appropriate for a client with a diagnosis of risk for activity intolerance? A. Perform nursing activities throughout the entire shift. B. Assess for signs of increased muscle tone. C. Minimize environmental noise. D. Teach clients to perform the Valsalva maneuver. Correct answer, C. Minimize environmental noise. When caring for a client who is at risk of activity intolerance, the nurse can diminish the impact of environmental stimuli by reducing noise. Environmental noise may require further energy from the client in order to manage his responses to stimuli. Reducing excess noise promotes rest and energy conservation. 53. A nurse is working with Mr. L, a client who is being seen for disrupted sleep patterns. The nurse encourages Mr. L to verbalize his feelings about sleep and his inability to maintain adequate sleep habits. What is the rationale for this action? Mr. L most likely has a mental illness that should be treated before his sleep issues. B. Mr. L may have unrecognized anxiety or fear that could be contributing to poor sleep habits. C. Mr. L may become tired once he starts talking. D. None of the above. Correct answer, B. Mr. L may have unrecognized anxiety or fear that could be contributing to poor sleep habits. Some clients have difficulties with sleep due to unrecognized anxiety or fears. By encouraging clients to express their feelings and thoughts regarding sleep and sleep issues, the nurse allows the client the chance to work through negative feelings. By working out potential issues, the client may experience greater peace and relaxation, promoting sleep. 54. Which of the following is an example of physical abuse? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer, A. A slap to the person's hand. Slapping, hitting, and punching are examples of physical abuse. Physical abuse is defined as doing something that can physically harm or injure a person. 55. Which of the following is an example of emotional abuse? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer, B. Threatening the person. Threatening a patient is an example of emotional abuse. 56. Which of the following is an example of emotional neglect? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer, C. Ignoring and isolating a person. Ignoring and isolating patients are examples of emotional neglect. Emotional neglect is not doing the right things in order to meet the emotional needs of patients. 57. A nurse is assessing an African American client for risks of a pressure ulcer. Which of the following best describes what the nurse might find with an early pressure ulcer in this client? A. Skin has a purple/bluish color. B. Capillary refill is 1 second. C. Skin appears blanched at the pressure site. D. Tenting appears when checking skin turgor. Correct answer, skin has a purple/bluish color. When assessing for signs of developing pressure ulcers in a client with dark skin, decreased circulation may not always be readily apparent. For instance, blanching, the red undertones seen in light-skinned clients, will not always be present. Instead, the skin of an early pressure ulcer may develop a purple or bluish color. 58. A nurse is preparing to irrigate a client's indwelling catheter through a closed, intermittent system. Which of the following steps must the nurse take as part of this process? A. Use sterile solution from the refrigerator. B. Position the client in the prone position. C. Clamp the catheter at the level above the injection port. D. Inject sterile solution through the injection port into the catheter. Correct answer: D. Inject sterile solution through the injection port into the catheter. When performing a closed intermittent system of catheter irrigation, the nurse should draw up sterile solution that has been at room temperature using sterile technique. The client should be positioned for easy access to the catheter site and to assess the abdomen during the procedure. After clamping the tubing below the level of the injection port and cleansing the site, the nurse injects fluid into the port, which travels up the catheter to irrigate the tubing and the bladder. 59. Which of the following is a negative outcome associated with impaired mobility? A. Increased amounts of calcium are absorbed from circulation. B. A drop in blood pressure occurs when rising from a sitting to a standing position. C. The amount of mucus in the bronchi and lungs decreases. D. The vessel walls of the circulatory system thicken. Correct answer: B. A drop in blood pressure occurs when rising from a sitting to a standing position. A client with impaired mobility may develop many changes in body systems that put him at risk of further illness or injury. Orthostatic hypotension occurs when blood pressure drops more than 25 mm of mercury systolic or 10 mm of mercury diastolic upon rising from a sitting or lying position to standing. Orthostatic hypotension may develop in the client with impaired mobility when blood circulates more slowly or pools in the distal extremities. 60. Which of the following statements best describes foot drop? A. The foot is permanently fixed in the dorsiflexion position. B. The foot is permanently fixed in the plantar flexion position. C. The toes of the foot are permanently fanned. D. The heel of the foot is permanently rotated outward. Correct answer: B. The foot is permanently fixed in the plantar flexion position. Foot drop results in the foot becoming permanently fixed in a plantar flexion position. This position points the toes downward. The client may be unable to put weight on the foot, making ambulation difficult. Foot drop can be caused by immobility or chronic illnesses that cause muscle changes, such as multiple sclerosis or Parkinson's disease. 61. A client is complaining of pain that starts in the shoulder and travels down the length of his arm. This type of pain is referred to as referred pain. B. Superficial pain. C. Radiating pain. D. Precipitating pain. Correct answer: C. Radiating pain. Radiating pain is that type of pain that starts in one part of the body and travels to other related areas. Examples of radiating pain include pain that travels along an extremity or pain that moves from the front of the body toward the back. Radiating pain may be constant or it may come and go. 62. You have taken the vital signs for your patient. They are normal for the patient. What should you do next? A. Report the vital signs to the doctor. B. Write the vital signs on a scrap paper. C. Call the family members. D. Document them on the graphic VS form. Correct answer: D. Document them on the graphic VS form. Vital signs for a patient are documented on a graphic VS form, not a scrap of paper. The vital signs are normal for your patient, so you do not have to report these VS to the doctor. Simply document them. 63. A procedure that examines a portion of the large intestine with an endoscope is called A. Colposcopy. B. Sigmoidoscopy. C. Upper GI. D. Cardiac catheterization. Correct answer: B. Sigmoidoscopy. The sigmoid colon is located in the descending colon. A special scope is inserted into the rectum and takes video and still images of the lining of the large intestine. An upper GI is used to take still photos and video of the esophagus and stomach. A KUB is a radiography procedure looking specifically at the kidneys, ureters, and bladder. A cardiac catheterization is a procedure where a thin instrument is placed through the femoral artery and threaded up the vasculature to the heart, where procedures can then be performed. 64. In the term hemoglobin, the suffix globin means A. Protein, B. Iron, C. Metal, D. Blood. Correct answer, A. Protein. The word part, globin, means protein. Hemoglobin is a medical term meaning blood protein. 65. A patient suffering from hyperglycemia would be experiencing A. Low blood sugar, B. High blood sugar, C. Normal blood sugar, D. None of the above. Correct answer, B. High blood sugar. Patients with hyperglycemia have a high concentration of glucose in the bloodstream. Most likely the patient will also be diagnosed with diabetes, commonly referred to in layman's terms as the sugar. 66. Which nursing intervention is most appropriate to reduce environmental stimuli that may cause discomfort for a client? A. Loosen pressure dressings on wounds. B. Use assistance to pull a client up in bed. C. Check temperature of water used in a sponge bath. D. Position the client prone. Correct answer, C. Check temperature of water used in a sponge bath. A nurse can reduce environmental stimuli that can cause discomfort for a client through several interventions. When giving a sponge bath, the nurse can check the temperature of the bath water to ensure it is not too hot to avoid burns, nor too cold to avoid causing discomfort. Other measures the nurse can perform include lifting clients rather than pulling them up in bed, changing wet dressings, and providing proper positioning while in bed. 67. A nurse is assisting a client with shampooing his hair while he is still in bed. While helping the client, the nurse raises the bed to approximately the level of her waist. What is the rationale for this action? A. To prevent shampoo from getting into the client's eyes. B. To allow excess water to run off the edge of the bed. C. To decrease strain on the nurse's back. D. To prevent the client's hair from developing tangles. Correct answer, C. To decrease strain on the nurse's back. When assisting a client with activities of daily living in which the client remains in bed, the nurse may raise the bed to a level that is appropriate for working. This reduces strain on the nurse's back and legs when she must stand at the bedside to assist the client. 68. A patient triaged as Class 4 in a mass casualty emergency situation means that the patient A. has life-threatening injuries but is expected to survive. B. has minor injuries and does not need immediate attention. C. has life-threatening injuries and is not expected to live. D. has major injuries but can wait 45 to 60 minutes for treatment. Correct answer, C. has life-threatening injuries and is not expected to live. A patient triaged as a Class 4 patient means that the patient is given the lowest priority because they are not expected to survive. Comfort measures can be implemented for the patient, but time and resources are not supposed to be spent on a patient who is unlikely to survive. 69. You see a patient lying on the floor of the bathroom. You are not assigned to this patient. What is the first thing that you should do? A. Get the nurse who is caring for the patient. B. Tell the nurse that the patient has had another seizure. C. Observe the patient for any injuries and call out for help. D. Nothing. This patient is not one of your assignments. Correct answer, C. Observe the patient for any injuries and call out for help. You should observe the patient for any injuries and call out for help. This is an emergency and you must act immediately even if the patient is not part of your assignment. You did not see this patient before they fell, so you do not know that the person has had a seizure. 70. You are ready to give your resident a complete bed bath. The temperature of this bath water should be which of the following? A. Cooler than a tub bath. B. Hotter than a tub bath. C. About 106 degrees. D. Over 120 degrees. Correct answer, C. About 106 degrees. The temperature of all bath and shower water should be about 106 degrees. A bath thermometer should be used to determine the temperature of all bath water to make sure that it is not too hot. Hot water can scald and burn a patient or resident. You must also be sure that the temperature is not too cool. Cool water is not comfortable for a bath or shower, and it can lead to shivering and chilling. 71. The nurse should wash from the underscore when washing a patient's eye area. A. Outer canthus to the inner canthus. B. Inner canthus to the inner canthus. C. Internal nares to the external nares. D. External nares to the internal nares. Correct answer, B. Inner canthus to the inner canthus. You would wash from the inner canthus of the eye near the nose to the outer canthus of the eye. This is done because you are moving from the cleanest area of the eye to the dirtiest part of the eye. The nares are the nasal passages. 72. Your patient had a stroke, or CVA, 5 years ago. The resident still has right-sided weakness. You are ready to transfer the resident from the bed to the wheelchair. The wheelchair should be positioned at the underscore. A. Head of the bed on the patient's right side. B. Head of the bed on the patient's left side. C. Bottom of the bed on the patient's right side. D. Bottom of the bed on the patient's left side. Correct answer, B. Head of the bed on the patient's left side. The wheelchair should be positioned at the head on the bed on the resident's left side so the resident can assist with the transfer with their stronger left side. Case Study 1. The nurse assumes care for a 78-year-old female client brought to the emergency department by family, reporting she has not been herself over the past 2 days. Exhibit 1. Primary assessment, neurological, GCS 13. Client opens eyes only to speech and is confused. Lethargic. Oriented to self and place. Disoriented to time and situation. Perla. Airway, patent, free from foreign bodies and secretions. Respiratory, coarse lung sounds at the bases, bilaterally. Tachypnea present. Labored respirations with accessory muscle use. Occasional productive cough with yellow sputum. Cardiovascular. +2 pulses peripherally. Capillary refill less than 2 seconds. Heart sounds are regular, and tachycardia. Skin is dry, an appropriate color for ethnicity, and warm. 73. After performing the initial assessment on the client, the nurse determines the client needs evaluation and interventions. Which is the appropriate action by the nurse? A. Move the client into the hallway to be closely monitored. B. Isolate the client by requesting family at the bedside to leave. C. Place a surgical mask on the client before transporting the client into a room. D. Perform hand hygiene before removing the gloves worn during the assessment. Correct answer, C. Place a surgical mask on the client before transporting the client into a room. The nurse should recognize that the client is experiencing potential infectious respiratory symptoms due to the cough and overall respiratory assessment. To maintain respiratory hygiene, the nurse should place a mask over the client prior to taking the client back to a room, which would go through the hallways, to prevent the client from dispersing infectious microorganisms into the air. Answer A is incorrect. It is inappropriate to place this client in the hallway due to suspicion that the client has an infectious microorganism and respiratory symptoms such as a cough. The client is exhibiting confusion, a common symptom in older adults with an infection. Therefore, the nurse should avoid placing the client in the hallway to protect other clients, staff, and visitors. Answer B is incorrect. The nurse does not need to ask the family to leave at this time. The nurse should instead ask if the family has been experiencing any similar symptoms, limit the family from excessively entering and exiting the room, encourage hand hygiene and respiratory hygiene, and educate and request them to wear a surgical mask to protect themselves as well as others in the event that the client has a transmissible respiratory illness. Answer D is incorrect. The nurse always uses standard precautions, which involve hand hygiene immediately after removing gloves, not before the removal of gloves. 74. Which medical intervention should the nurse anticipate performing first? A. Administers via nasal cannula. B. Obtain a full set of vital signs. C. Performs a detailed health history. D. Contact the healthcare provider. Correct answer, A. Administers via nasal cannula. The signs and symptoms of respiratory distress, including labored respirations, tachypnea, and the use of accessory muscles, indicate that the client is not receiving sufficient oxygen and is attempting to compensate by increasing the respiratory rate and displaying an increased effort. Therefore, the nurse should anticipate administering 2LO via nasal cannula. Answers B and C are incorrect. The nurse must first respond appropriately to the client's respiratory distress. A full set of vital signs and a detailed health history is a part of the secondary assessment. Answer D is incorrect. The nurse must first intervene and respond to the client's physiological needs before contacting the healthcare provider. Applying 2L of supplementary is an action the nurse can initiate before contacting the healthcare provider. 75. Exhibit 2. The nurse obtains the client's vital signs, 1123, T, 37.7 degrees Celsius, 99.9 degrees Fahrenheit orally, HR 118 BPM, BP 100/58 mmHg, RR 22 breaths/min. Pulse ox 95% via 2L nasal cannula, pain 0 out of 10. Which of these findings should be concerning to the nurse? Select all that apply. A. Blood pressure of 100/58 mmHg. B. 95% pulse oximetry on supplemental O. C. Temperature of 37.7 and #194 and #176. C. 99.9 and #194 and #176. FD. Heart rate of 118 BPM. Correct answer, both C and D. The nurse should recognize that the client's oral temperature and heart rate are elevated. Older adult client's temperature can be 1 to 2 degrees lower than the younger adult. Therefore, a temperature of 37.7 degrees Celsius, 99.9 degrees Fahrenheit orally can be recognized as a fever for the older adult. The most accurate temperature is a core temperature, such as a rectal temperature. Therefore, the nurse should recheck the client's temperature using the most accurate method. The nurse should prioritize findings based on the client's ABCs, airway, breathing, and circulation. The client's HR of 118 BPM is elevated, normal 60 to 100 BPM. An elevated heart rate indicates the client is experiencing a physiological response to attempt to maintain homeostasis. Answers A and B are incorrect. The client's BP is currently adequate. A hypotensive BP is a systolic BP of less than 90 mm of mercury or a MAP less than 70 mm of mercury. This BP is adequate and indicates the client is receiving adequate perfusion. Similarly, a pulse oximetry of 95% is adequate. The nurse maintains a client's pulse oximetry at 95 to 100% for adequate oxygenation and to avoid hypoxia. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.